contact tracing going to play a critical role in fighting coronavirus? It's been practiced for decades, but never on this scale. How's it all taking shape? Maria Medina is here with tonight's original report for us. Maria?
And Alan, contact tracing apps are already being used in other countries and some states, but here in California, it's still being done the traditional way, on the phone, person to person.
We really need to think about on a deeper level what I'm capable to do. It's going to call us. It's going to call us to adapt.
When COVID-19 made Robin Fletcher's sales job grind to a halt, she jumped at an opportunity to use her people skills for something more meaningful.
And a friend mentioned contact tracing. I'd never heard of it, even though it's been around for a bit.
Contact tracing starts with basic detective work. The average person who has the coronavirus transmits it to 2 or 3 other people, who then potentially could transmit it to 3 others. So one contact leads to another, and everyone along the way has to be notified, isolated, and treated if necessary to contain the virus's spread.
Today, I'm going to talk to you about the basics of contact tracing.
Robin's first step, a free 5-hour online course offered through Johns Hopkins University, where she learned the types of questions to ask, skills for effective communication, and how to balance public good with privacy.
There seems to be a very, very huge and very clear reinforcement of the idea that this is done with a purpose. It's done for the right reasons. It's done with huge respect.
The CDC estimates at least 100,000 contact tracers will be needed to combat the coronavirus, but they are just one piece of a complex process.
So our team is very multidisciplinary.
Dr. Darpan Sachdev is lead expert physician for contact tracing at the San Francisco Department of Public Health.
We have case investigators who are the first line of calling people after they get a new diagnosis with COVID. We then have our case investigators working very closely with clinical leads. We also then are working very closely with a team of social workers who help us to identify resources for people who need to isolate and quarantine.
San Francisco is working with UCSF on the project using a customized data gathering program.
And that's just a way of making sure that once we've interviewed someone, that all the different touch points can be notified at the same time. And so our goal is really to ensure that people get tested on that day that we're notifying them or the next day.
She says for now in San Francisco, only health department staff are involved, but outsourcing will soon become necessary, and third-party companies are already poised to provide.
Most health authorities, they're already doing some form of contact tracing. They're using their existing staff to pull lab results of infected patients, but they've all reached capacity.
Aaron Thames works for Applied Memetics, an outsourcing company for businesses that now target the contact tracing market.
What they're looking for is not only those contact tracer roles, but coordinator, investigator, and navigator roles so they can manage those tracer teams.
Robin Fletcher has already applied. She hopes her sales experience will help her get a job she really wants and needs.
You got to have some courage, to put it politely, to pick up the phone and call someone and establish immediate rapport and do it well. There is an aspect of educating. There's an aspect of social work. There's an aspect of just being a good listener. There's a lot of skills that people, I think, can really bring to this.
And one positive note to contact tracing the coronavirus, according to the doctor, face masks are actually really helping to narrow the field of potentially exposed people who need to be tracked down. Alan?
So what are you hearing from people after they're called by a contact tracer? What's the reaction?
Yeah, interesting question. In San Francisco, at least according to the health department, people are actually happy to know that there is someone there to help.
That's good to hear. More we know.